Hello. Today I'm here to talk about addressing the chronic illness epidemic in Canada through preventative measures. It is no surprise that chronic illnesses are currently the largest burden in the Canadian healthcare system. Over the last century, the pattern of chronic diseases has skyrocketed. These diseases account for over 90% of all deaths and over 58% of all healthcare costs. Far more Canadians are suffering more than ever. So what are some of these chronic diseases that are some of the heavy hitters? Well, we have things like cancer, lung disease, heart disease, diabetes, Alzheimer's, and chronic liver and kidney disease. Throughout this presentation, I will outline the status quo of our healthcare system, how we should shift from the current model to one that encompasses more prevention, and the potential opportunity and challenges of integrating such a model. Preventative care involves public health, functional medicine, and integrative medicine for the purposes of this presentation and the report. Public health is known as the art and the science of preventing disease, prolonging life and promoting health through organized efforts of society. So right now, we have a department known as the Public Health Agency of Canada. They focus on preventing disease and injuries, promoting physical health and mental health, and providing information to support informed decision-making. Functional medicine practices addressing root causes to avoid disease. And integrative medicine, on the other side, uses kind of unconventional, holistic practices, not always necessarily addressing the most root cause, but using practices such as acupuncture, meditation, massage therapy, animal-related therapy. The current system was designed to treat reactively by addressing urgent issues. It was not designed to help prevent the onset of disease, but to treat acute illness for what was once a young and healthy population. Acute illnesses, as we know, tend to be short, diagnosed easily, and treated with a cure. Chronic conditions, on the other hand, are defined as long-term physical and mental conditions diagnosed by a healthcare professional that has lasted or is at least expected to last more than 6 months. So what is the impact of chronic diseases? Let's take a look at the numbers. As previously mentioned, over 90% of mortalities are due to chronic diseases. The other 10% are due to external factors. Half the population over the age of 20 has at least one chronic disease. One chronic disease itself, as we know, is very complex, but often individuals suffer from multiple chronic diseases, whether it's 2 or more, or this addition of chronic diseases is known as multimorbidity. The prevalence of multimorbidity among Canadians 40 years and older is approximately 26.5%. And from an economic perspective, chronic diseases currently cost our economy $190 billion annually. $122 billion of that are due to indirect income and productivity losses, while $68 billion in direct healthcare expenditure. This direct cost accounts for 58% of the annual healthcare spending in our country. In terms of preventative methodology, there are 2 ways of addressing it: proactive solutions and predictive solutions. Proactive solutions involve classifying individuals based on key risk factors. Risk factors directly lead to over 90% of the chronic diseases that we see today. Some of these risk factors include diet, physical activity, alcohol consumption, and tobacco use. Predictive care involves a much further personalized approach and intervening as early as possible through solutions such as genetic testing, epigenetics, individualizing diet plans and lifestyle and activities, even drugs based on the individual genotypes of the individual that is being assessed. So we know what a lot of these problems are, but the bigger issue is how do we fix them? So we're going to look at some of the integration challenges. The current model is deeply embedded within our healthcare system. This makes it very difficult to incorporate health promotion and prevention. Some factors that play into this are things like the fact that innovation is very slow. Doctors treat as quickly as possible, and patients are often denied important blood markers due to the high cost of testing, and therefore we cannot have comprehensive blood testing and getting the patients the markers that they need to know to properly address their issues. On top of this, for the blood markers that they do receive and the medications that they do receive, patients are uninformed and therefore act as passive recipients of their blood work results and treatments. Overall, they're uninformed of their healthcare status. And some of the other barriers within the political spectrum include resources. We need to move resources to strengthen our current system towards prevention, but even further down the line to some of the social determinants of health. And this includes things such as education, employment, working conditions, personal health practices, healthy child development. We need buy-ins from all of these different social determinant systems. Include, patients, practitioners, insurance plan providers, sponsors, employers. So how do we facilitate solutions? Well, one of the first things we need to do is put increased focus on positive health outcomes. Other countries are doing this at the moment and are seeing success. The current structure that we use is a fee-for-service incentive. So this means doctors get paid based on the amount of patients they see, and this is why we are getting pushed in and out of the door so quickly. But if we're using a health outcome perspective, then doctors are going to spend more time with their patients, because if they fix the solution, if they address the illness that is being seen, the patients have positive health outcomes, the incentives will be driven by that. We also need collaborative approaches. So kind of similar message to the participation and the integration challenges. We need multi-sector approaches where things like agriculture, education, housing, all of those things are all being implemented within the healthcare system, all being improved to help the healthcare system. Some of the models that other countries are using include things like social impact bonds, where companies are getting paid, whether it's through government or whether it's through private payers. They were getting paid based on health outcomes. These are currently being trialed in the United Kingdom and also Australia, and are awaiting the results to see if these models are successful. So far, the early trials look promising. Patients need to be more accountable. That's a given. We've known this for a long time, but in order to allow them to be more accountable, we can set up a system where they are more informed, they know what's going on, and therefore they'll have the incentive to want to take control of their health care. If they act as active players in managing their health, rather than passive recipients of care, we will see much more positive health outcomes. In Canada, close to 11 million people live with pre-diabetes or diabetes. Direct expenditure in 2017 was $15 billion itself. Experts predict that if we continue at the rate that we're going at, we will be at $39 billion by the year of 2028. Preventative measures can be used to treat and prevent type 2 diabetes. For type 1 diabetes, Australia and South Korea provide government funding on CGMs, which drastically improve blood sugar management. If the potential for prevention could be translated into reality, this could free up over 6,000 hospital beds across Canada. Much of our healthcare resources could be moved into preventative solutions. We need to empower individuals to be well and stay well through self-accountability, balanced living, and healthy diets. If we decide as a country to become a leader in embracing progressive evidence-based findings, a new proven technologies in preventative care, the healthcare crisis will begin to retreat and produce a positive domino effect on all other areas of healthcare, as more money and resources will be available. And most importantly, avoiding illness safeguards the ability for us to enjoy a better quality of life. Thank you.